Dr. Goldhamer, thank you so much for joining us on the Plant Trainers podcast today.
It's my pleasure. I'm glad to be here.
We are super excited to talk to you about all things fasting and intermittent fasting and all of that. But we would also, before we begin, love to know what's on your mind and what are you grateful for today?
Oh, well, today is obvious. The club that I play basketball in has gone mask-free. And so being able to breathe while you run up and down the basketball court definitely is more pleasant. It took a few minutes to get used to actually being able to oxygenate, but definitely grateful for that today.
That's wonderful. It's so nice to get fresh air while you work out.
We're not there yet. And I know that the students that I teach would be so excited to get their masks off their face when they're running up and down the court and playing on their, whether it's volleyball or basketball, whatever. It makes such a big difference. And at the same time, wearing those masks, actually, I find that it helps you improve your oxygen uptake, but it's much harder to deal with. So it'll definitely be a great thing to get rid of those masks.
And I've actually been mask free in the catchball, but I guess it's not as even though we are pretty contact, it's not much of a contact sport or considered. But let's talk a little bit about the plant-based lifestyle and tell us your version of how you found plant-based and what it may have changed for you when you first began.
Well, actually, I don't support a plant-based diet. I support an exclusively plant food diet. So we advocate exclusively whole plant foods that's SOS free. And of course, SOS stands for the International Symbol of Danger. And also the chemicals that are added to food that make people fat, sick, and miserable. And those are salt, oil, and sugar. So we add these chemicals to the feed, and whether it's humans or animals, the result is very predictable. It's systematic overeating. And when you eliminate those chemicals, the salt, oil, and sugar, you also eliminate the consequence of overweight and obesity that results, which means you eliminate the metabolic syndrome, and then you eliminate the vulnerability to dying from heart disease, cancer, autoimmune diseases, and even things like COVID-19.
And how quickly do you normally see people start to make improvements in their health once they start to go SOS free?
Well, you know, it's interesting because at the True North Health Center, we've used an SOS-free diet for 39 years that we've been in practice. And the changes happen immediately. In fact, we have to be really careful because the reason most people are so heavily medicated is not because of their conditions, but because of their diet. And the moment you change their diet, you have to begin to adjust their medications or you end up with a toxicity effect from excess medication that's no longer necessary because you've eliminated the reason why they were taking the medications to begin with, which was the greasy, fatty, slimy, processed food diet.
We found that with my father as well. When they come to visit us and they eat dinner at our house, we never keep orange juice in the house, but we have to have orange juice around when my dad's here because his insulin, even if now he's catching on and trying to adjust the insulin when he does come to visit, but his insulin, he's overtaking his insulin when he eats with us and he's dipping in the middle of the night. So he's having that insulin residue, right? That's creating that dip in his body.
Yeah, because most of his need for insulin is because of the diet he's choosing to eat. The moment you start changing that diet, you start changing the need for the exogenous support. People start actually getting well. But, you know, it can be disturbing at first because, for example, if you have high blood pressure, you've been told by your doctor, number one, you'll never get well. You'll be sick the rest of your life and you'll be on these drugs forever. And yes, there are side effects like chronic cough, fatigue, impotence, and premature death. But since we don't know what causes high blood pressure, there's nothing we can give you to cure it. So the best we can do is manage your symptoms with these drugs. But the moment you begin changing the diet, even before you've lost all the weight and all that, blood pressure starts coming down. If you keep taking that same level of medication, you may end up with orthostatic hypotension, a hypotensive response when you get up or something. And so, you know, you see really clearly in a controlled setting that people are being drugged for their diet. Change the diet, change the need for drugs.
So that's really interesting. We've had a lot of people come to us and say, oh, I went plant-based and I didn't feel well. Right. So I started eating the way I was before. So right. What would be some of those symptoms that somebody on blood pressure medication would feel if they went very clean plant-based or SOS free? What would they start to feel and that to give them an indication that it's not the plant-based diet that's making them not feeling well, but it's actually the excess of medication.
Well, excess medication, oftentimes with at least blood pressure medications, there's a whole variety of them, but most of them are going to be around orthostatic hypotension, dizziness, vertigo, weakness. But it's like saying an alcoholic saying, oh, I tried quit drinking, but I didn't feel good. So it's clearly my body needs alcohol. I must have an alcohol deficiency, because as soon as I start, I get headaches and nausea and all kinds of withdrawal symptoms and shakes. So I just have to keep drinking alcohol. The same thing when people are eating greasy, fatty, processed, slimy diets and they stop eating. Of course, the body starts purging and detoxing, and you get all kinds of symptoms that can be uncomfortable, including fatigue and irritability and headaches, etc. But those are withdrawal effects from being an addict. These people are addicted to the artificial stimulation of dopamine in their brain that comes from adding these chemicals to their feed. And the moment you stop that, it begins to reverse.
And so if somebody just took all that out and went SOS right away, can they do that without a doctor being present? Like, how do they know if they should lower their medication? I'm talking if they're not at True North, obviously.
Or the doctor won't see them.
Well, I think it's important when people are being medicated that they work either with their doctor, hopefully who's not an idiot, or they can work remotely with one of our doctors through our telemedicine practice, where you work with a doctor that's used to actually having people get well. Most doctors say, well, no, you can't stop taking the meds. You have to be on the drugs the rest of your life. That's it. You're never getting well. You're overweight. No, you can't lose weight and keep it off. We know from statistics that none of the stuff that we tell you to do works, so forget about it. Just accept yourself the way you are, accept the consequences, and realize that's just how life is. Or you can work with a doctor that's had the novel experience of actually seeing people make radical diet and lifestyle changes. Eat healthy, exercise, go to bed, stuff like that, and actually see the body unwind itself and get well. At True North, we use medically supervised water-only fasting. So people are on water only for periods ranging from 5 to 40 days. The same thing happens. It's just really quick. It's a fast way of getting those changes. But if people apply the diet and lifestyle changes, whether they fast or not, many of these things will resolve. In fact, it's interesting. Because we're booked out a few months, it takes people a while to get a bed. They'll work with our doctors remotely on diet change. And many times, annoyingly enough, by the time they come in, they're already better. Their blood pressure's already down, their blood sugar's already down, the weight's already coming off. And, we have to adapt to that, because health is the result of healthful living. It's diet, sleep, exercise. Fasting is just a facilitator. It's a way of making things happen more quickly. And it's great. But, diet, sleep, and exercise, if you want to get healthy, you have to do those things. If you do them right, you get a good result.
Okay,
there's different opinions about what right is. Sleep, one of our most important activities. You've got to go to bed early enough that you can wake spontaneously feeling refreshed. Exercise, you have to exercise enough, but not so much that you overload the system. And with diet, we advocate an exclusively whole plant food diet that's SOS free. Now, it doesn't mean there's not other ways people might choose to eat, and other ways might work well for them too. That's fine. This just happens to be the approach that we've determined, based on our experience and review of the scientific literature, works the best for the majority of our patients. And so that's how we do it. I don't care what you do as long as it's actually successful. The problem is a lot of people are told, well, you got to have greasy, fatty, processed stuff because you're going to eat. It's all nonsense. They don't actually have experience or data to support long-term effect of their diets. The diets that they're using for short-term weight loss, the dead Dr. Atkins diet, for example, may his fillet of soul rest in peace, might be effective for some people to lose weight, but it doesn't mean it's a long-term sustainable health promoting diet. I'm interested in what's going to keep people alive and functioning for decades, not just for a few months, and not just looking at weight as the only variable. If you really want to lose weight quickly, 40 pounds overnight, just cut your hip off at the leg off at the hip, use a chainsaw, boom, 40 pounds. It doesn't mean it's healthy.
So you just said, I don't care what they do as long as they're successful.
Yes.
What is your definition of successful at that point?
Successful is doing the things that it's going to take to enhance healthy life expectancy, not just life expectancy, because we know how long people live is largely determined by genetics and luck. But how well they live in the time they have left, their healthy life expectancy. Do they live right to before they go to sleep one night and don't wake up because they reached their genetic potential? Or do they spend the last 10 years of their life unable to talk or move, lying in some nursing home bed waiting for people to change their diaper? Healthy life expectancy is what most of my patients are most concerned about. And healthy life expectancy is enhanced with a health-promoting diet, a whole plant food, SOS-free diet. And we know that because we're getting 35-year follow-ups now on patients that have been doing this dietary approach for decades. And what they tell us is the same story over and over again. Yeah, all my friends are dead. Some of them are outliving their kids that are continuing to eat conventional diets. In fact, my mother, when she's 92, she told me, she said, Alan, I've outlived all of my friends. They're all dead. And it's very hard to make new friends in your 90s because even people younger are still too old and sick. They don't want to play bridge. They don't want to do anything. He says, you have to warn your patients. If they're going to do this diet, make younger friends.
That's really cute. That reminds me of my grandmother a little. She's 99. Legally, she's 100. Then, she came off the boat. They just gave her a birthday. But she's outlived all of her friends, all of her family. She's making friends now that are 20 years younger than her. And she will not befriend anybody who's all achy pachy and fetchy and doesn't want to go out and doesn't want to do anything. She doesn't want to be around that. Yeah.
Yeah, that's a real problem as people age because there's so few people that are retaining vitality that they become an extreme minority.
You very quickly before mentioned that at True North, you do water fast for 5 to 40 days. And some of our listeners, I hear them saying, holy moly, that's a long time to just be on water. How is that even possible? How do they do that? Why would I even want to do a water fast? And can I do it on my own? There's a bunch of questions there that maybe you could share.
Last question first. Yes, you can do it on your own. We recommend everybody fast every day for 12 to 16 hours. And you do that by not eating 3 to 4 hours before you go to sleep at night, maybe get a little exercise in the morning before you have breakfast. And by not eating for that 12 to 16 hours, for many people, that's helpful at limiting their dietary excess intake. And if in the 8 or 12 hours that you're eating, you limit it to exclusively whole plant food, SOS-free foods, what's going to happen is if you're a female, on average, you're going to lose about 2 pounds a week down to optimum weight. If you're a male, you're going to lose about 3. Males lose about 50% weight, about 50% faster because they're full of testosterone, which is a fat-burning hormone. In fact, if you injected women with enough testosterone, their fat would melt off them.
But you don't recommend people go.
No, because they would get hair and get cancer and die. It's not a good strategy. In men, if you inject men with estrogen, they get fat, they get breasts, they get hips. These are biological differences. But bottom line is if people adopt whole plant food diets, limit their feeding window, it makes it easier for them. And also then they're not eating right before they go to sleep. There's a little bit more efficiency at burning the calories they eat. They sleep more soundly because they're not having to wake up and emptying their bladders and all the other stuff at night. And so this intermittent fasting can be safely done by virtually everybody. Longer term fasting needs to have a few parameters considered. Number one, a medical history exam and laboratory monitoring to make sure you're a good candidate for fasting. Not everybody is a good candidate for fasting, particularly people that are on medical management with medications and whatnot. That you don't fast when you're taking medications generally. So the idea is you want to make sure first you're a good candidate for fasting. And then if you're going to do long-term fasting, you still want to work with a doctor, whether it's your own doctor or a doctor like at True North Health that's familiar with the physiology so they can advise you, because there are issues of hydration and other things that you need to be aware of with long-term fasting. But what we have done is we've published a fasting safety study. People can review that. If they go to the Foundation's website at fasting.org, all of our studies are freely available. And we've shown that fasting can be done safely and effectively, including up to 40 days, if the protocols are followed, history exam, lab, and monitoring. And so that does need to be supported. It's not something you want to tell people you're resting during that state. For example, if people are too active during their fasting state, instead of burning primarily fat, which is what happens in resting fasting, you have to mobilize more protein through gluconeogenesis in order to meet the glucose needs of the body when you're too active. So we do recommend that people are resting, that they're, in our clinic, they're monitored twice a day by doctors. We do appropriate blood and urine testing. And that's how we've been able to do 21,000 people fasting and have everybody that walked in be able to walk out. And so, it can actually be done very safely, very effectively, but there's a very specific protocol that's followed.
So is it safe for me to be at home right now and just say, you know what, tomorrow I'm not going to eat any food. I'm just going to drink water. And if so, how many days can I do that for safely without?
You can do that safely every day for up to 16 hours. And if you're going to go beyond that, what I'd recommend is you either check in with your own physician or with one of our doctors, make sure there's been a history exam in lab, make sure that the considerations in terms of your own medical history, medication uses are taken into account. You know, one thing that you can do though, you or anybody that's listening, if they're interested in knowing, am I a good candidate to consider this? All they have to do is go to our website at truenorthhealth.com, fill out the registration forms, which gets us the medical history, and call me, and I will at no cost be happy to talk to you on the phone and give you my opinion about, is this an approach that's appropriate? And if it is, and you don't live close enough to say True North Health Center, we can give you the names of doctors that we've trained that are in, you know, Ohio or Southern California or Florida or Texas or some other place, or you can access the doctors on the telemedicine through True North Health, which service the whole world, and they can help provide support to you. If you're going to do it at home, you'd want to still do it in conjunction with your local physician, but our doctors can advise you and your physician about what they might want to evaluate in terms of blood testing and whatnot to make sure that you're a good candidate, that it's going to be a safe and effective experience. Honestly, for most patients, long-term water fasting is best done in one of the facilities that does fasting, so it's much more efficient than where people are trying to deal with all their well-meaning, misguided relatives that are afraid they're going to die because they didn't eat for a few. You know, most people think if they get on a plane in New York and they flew to California, they will die. Over Colorado, if they don't eat the peanuts or the pretzels, they think those pretzels saved their life, you know.
Well, maybe it did. Maybe it will, just in terms of them just going batty. I know sometimes when I know I'm not going to eat for a long period of time, I really need to work that out in my head and prepare myself for it. So I kind of get where they're coming from. But I did a 5-day water fast myself at home, and not necessarily saying other people should follow suit, but I'm pretty in tune with my body, and I didn't do my extreme exercise during it, but when I got to the 4.5-day mark, I kind of knew, okay, I don't know what the benefit would be beyond this, but it doesn't feel like it's going to be positive. So if somebody's doing it at home, what are some of the signs that they should stop?
So the benefit of fasting actually begins from about 5 days on. There's some early benefit, but it's not until you really get into the fasting state that some of the intense healing responses that we can talk about really kick in. And so that's why there's a really interesting little window. Up to 16 hours, you're not burning protein, you're burning glycogen stores. Between 16 hours and a few days, that's the most expensive part of fasting. That's where you're burning a disproportionate higher ratio of protein and other issues. And so that is a period where people really need to do that right in order to be able to get into the fasting state effectively. And that means resting. It means not engaging in normal activities. You're not driving, you're not working, because otherwise what ends up happening is you don't get that efficient, effective conversion. And so people have all kinds of symptoms that make them think that fasting can't be done, effectively. The important thing I want to mention here, though, is if people use intermittent fasting every day and they apply a whole plant food SOS-free diet every day, the need for fasting can be dramatically reduced for most people. And then if they do occasionally need to do a longer term fast, or they have health conditions that require that, they have high blood pressure or diabetes or autoimmune disease, or they've got lymphoma, that's when they really want to get some advice so that they end up doing it properly.
So what are some of those benefits that kick in after that 5-day mark?
Well, if you look at the conditions of dietary excess, for example, high blood pressure, we did a study, we took 174 consecutive patients with high blood pressure, and 174 people achieved normal enough blood pressure that they could eliminate the need for medication. Diabetics, about 80% of our type 2 diabetics, even in a single fast, will achieve normal blood sugar levels, and those willing to continue to do the diet and exercise protocols are able to sustain it. Autoimmune diseases, the rheumatoid arthritis, the ulcerative colitis, the ankylosing spondylitis, the SLE, the asthma, eczema, psoriasis, these conditions where it's your immune system is attacking your own tissues, the response is profound, dramatic, and predictable, in part because you're helping heal up the gut leakage sources, in part because of detoxification effects. There's numerous mechanisms that we know that are going up or going down, in fasting. There's an unbelievable amount of new research has been done, in part by people like Walter Longo and others that have been doing a fabulous job of looking at the biochemistry, not just in animal studies, but also in people. For example, there's a number of biomarkers that they've identified, things like adenopectin and ghrelin and AMPK that go down in fasting. And as they go down, inflammation goes down, and things like mitochondrial biosynthesis go up. So the actual energy producing components within the cells are impacted by fasting. The fuel that you burn when you're fasting in your brain is BHB, beta hydroxybutyric acid. The higher your BHB levels, the more BDNF is produced. BDNF is brain-derived neurotrophic factor. That's the chemical that protects the nerves of the brain from oxidative damage. That's what causes Alzheimer's disease and dementia. You know, they've done studies where they took rats, identical rats, in 2 cages. Everything's the same, except they give one half of the rats a little wheel that the rat can exercise on, and it will. And the rats that exercised, they noticed, didn't get dementia. And they said, why? Why are these rats getting cognitive decline as they age, and these rats don't lose cognitive function? And they determined that partly it was because the rats that exercise have high levels of brain-derived neurotrophic factor, protects their brains from oxidative damage. Well, it goes up with exercise. It also goes up with fasting. In fact, it's interesting. If you look at the biomarkers that go up with fasting, they're often the same biomarkers that improve with exercise. And that's not intuitively obvious, because you'd say, well, wait a second, fasting, you're resting. Exercise, you're vigorously active. Why are they both having the same biomarker effects? And I believe it might be because both exercise and fasting have one very important thing in common, is they both undo the consequences of dietary excess. And it's dietary excess that's causing these inflammatory conditions and causing this premature death. So it's not shocking that every time you look at things that improve with exercise, often those same biomarkers improve with fasting. So we know that the higher BHB means higher BDNF, and higher BDNF is thought to protect the brain. We know that insulin sensitivity improves with fasting. It doesn't improve with the drugs that are used to treat diabetes. In fact, insulin resistance gets more and more over time. But fasting improves insulin sensitivity. And guess what else improves insulin sensitivity? Exercise. Mm-hmm. So exercising over time and fasting reduces the need for diabetic control. Cellular stress resistance and cellular stress adaptation was mentioned by Walter Longo. Again, they have rats, genetically identical rats, 30 rats, and they're all induced cancer. They give these one half the group chemotherapy, enough to kill all the cancer cells, and all the rats die. Now you say, well, why did they have to kill all the cells? Why don't they just kill a few cells? Because if you leave cells, they grow back. So you have to kill all the cells, but if you give enough chemotherapy to kill all the cells, you also kill all the rats, which, you know, reduces the effectiveness, doesn't it? But it's the same rats with the same cancer and the same chemotherapy, but they fasted the rats before, during, and after treatment. All 30 rats survived, dramatically enhanced cancer-free survival. And what they discovered was that cancer cells don't compete in a ketotic environment as well as regular cells. Regular cells are designed for ketosis because fasting is a biological adaptation. So that you had to be able to adapt to that state, and they do. The problem is that cancer cells also are more vulnerable to chemotherapy in a fasting state because they have a much higher metabolic rate. They need a high glucose environment. You put them in a high fat environment, they don't do as well. And so it made chemotherapy more effective. Well, it turns out that the biomarkers associated with cancer change whether you give chemotherapy or not. So it doesn't mean that it doesn't work better with chemotherapy. It just means that just the process of fasting puts cancer cells at a selective disadvantage. Autophagy, you know, the Nobel Prize for Medicine in 2016 went to Yoshinori Oshumi, who was the guy that talked about autophagy, autophagy, self-eating. The body's immune system about to eat up the cancer cells and get rid of the cellular debris and reverse the consequences of aging. Autophagy is enhanced by fasting. And that may be one of the reasons why the animals live so much longer when you introduce periodic fasting. And then another big issue is the effect of fasting on the gut microbiome. You know, you have 5 pounds of organisms living inside your intestinal tract right now. That's 1 trillion creatures swimming around, eating, drinking, respirating, and defecating inside you. You got 5 pounds of creatures pooing inside your intestinal tract right this minute. And what they poo in you could be toxic waste like TMA, which become trimethylamine oxidase, which the higher your TMA levels, the higher your colon cancer risk and heart disease and all that other stuff. But they could also be pooing fertilizer in you, like vitamin K and things you need to survive. So what determines what those organisms are pooing inside you is what you feed them. It's like every other animal, every other creature. So if you feed them meat, you're going to have high TMA levels. We know that meat eaters have much higher TMA, which becomes TMAO, which is thought to be one of the reasons why they're dying from all kinds of diseases. If you feed them soluble fibers, though, you get fertilizer. And so if you want fertilizer instead of toxic waste, I suggest considering a whole plant food diet. Now, there's more to it than that. It's not just how much poo a few organisms give off, but also the diversity of your flora. So it's thought that the wider your microflora diversity, the better your defenses against cancer and heart disease, diabetes, and even COVID-19 and other infections. So how do you get a broad diversity? Well, the problem is some people have altered their microflora by taking antibiotics or using drugs or taking antiseptics or doing all kinds of chemicals and alcohol and different things, which alter the normal healthy microbiome. So we believe that fasting is like rebooting the hard drive in a computer that's become corrupted. You shut it off, there's a big drop down in total quantity, you reboot it with refeeding, but you refeed it on a whole plant food SOS-free diet, and then you grow back a broad spectrum diversity of organisms and stop making as much toxic waste. And that's certainly consistent clinically with what we've seen in helping people overcome ulcerative colitis and Crohn's disease and chronic constipation, et cetera. Now, we've done a research project where we looked at stool samples before, after, and on follow-up. That data is not available yet. So we've done the research, we're waiting for the results, and hopefully that will confirm our suspicions that the explanation of why these people are getting better is improved microbiome diversity. So lots of things that are impacted by fasting. Some things go down though. So for example, weight. You know, people lose a pound a day on average. So it's but it's not just, you know, when you lose weight in fasting, some of it's fat, some of it's visceral fat, the type of fat that's most associated with dysfunction. You also lose protein, fiber, water, and glycogen. And it used to be people said, oh, well, you lose weight, but you gain it right back. Because when you go on a fast, you lose weight. When you come off, you tend to regain some weight. What we did is a study, and we took a DEXA scanner where you can do detailed whole body composition, and we looked at it before fasting, after follow-up at 6 weeks, and now we're actually getting 1 year follow-ups. And what we discovered was fascinating. The weight that's lost in fasting consists of fat, water, protein, glycogen, and fiber. And then the weight that's regained after fasting on a whole plant food diet is water, fiber, glycogen, and protein, not fat. The fat continues to go down. And in fact, the ratio of visceral fat loss in fasting is higher than any other treatment that we've seen, including the dead Dr. Atkins diet. The ratio of visceral fat is almost 3 to 1. And so that means a person that might lose, say, 20% of their total body fat in fasting could lose 50% or more of their visceral fat. And then when we looked at the body composition 6 weeks after fasting, not only had they recovered their protein, fiber, glycogen, and water, but their lean tissue mass was actually higher at 6 weeks than it was before they started fasting, despite the fact that they had lost substantial and maintained substantial net weight loss. So basically what we're saying, if you do fasting and you feed properly, you lose your fat and particularly your visceral fat. You do lose some protein, fiber, glycogen, and water during fasting, but it's recovered rapidly after fasting, even though you're still losing fat.
So, wow. So there's a lot there, but I know people are thinking, what should I eat when I'm done the fast?
Yes.
But I mean, obviously we're aware SOS free, right? Or maybe we're not all completely SOS free, but very, very clean, plant-based, little oil, unless you're in a restaurant, that kind of stuff. But what exactly should people eat moving forward so that they don't just go and reverse everything?
Or how do I even know when it's okay to start eating?
Right. So with fasting, again, that's where sometimes advice can be helpful. And when we say 5 to 40 days, some people, a 5-day fast is the maximum right amount. Some people are going to need up to 40 days. Some people may need several fasts, but that's going to be depending on their goals and circumstances. Healthy people, generally the fasts are short, 5 to 10 days. You don't need to do long-term fasting. People that have health problems sometimes need to do much longer. Some people need much longer, but they don't have the reserves or capacity to do it. So you have to modify it. But that's more of a clinical management strategy. But whatever length of fast you have, it takes about half the length of the fast in a controlled setting to do proper refeeding. The biggest mistakes people make are too rapid a return to feeding after fasting, and that can result in very serious problems, including refeeding syndrome, where your electrolytes get off and you have serious problems, and it could be even fatal on a long fast. So we recommend that refeeding period be done just as carefully as the fasting is done. And we use normally fresh fruit or vegetable juices, 1 day of juice for every 10 days of fasting. So a 40-day fast might have 4 days of juice, and then there'd be 4 days of raw fruits and vegetables. And then we'd introduce steamed and starchy vegetables. It's done in a very progressive manner, watching how the digestive system kicks back in. So it's done really carefully. That's really some of the most important part of fasting, is careful and appropriate refeeding. And also, a lot of the toxins that are mobilized during fasting are actually eliminated after fasting, because most of your body toxins don't come out in the stools, they come out in the urine. Because the urine is what happens when the blood has been filtered by the kidneys. And it's in the blood that most of the toxicity that we're talking about is going to be processed, not the bowels. The bowels are actually not even in your body. There's a hole here, and then it goes through the digestive system, and there's another hole at the other end. And digestion is shoving stuff in one hole and then eventually pushing it out the other hole. None of that's in the digestive system, and none of that's in the body until it gets absorbed through the intestinal mucosa into the body. So you wouldn't expect the bowels to be the main source of detoxification. They're not. The stuff you're detoxifying from inside your body comes out in your urine, which is why we don't recommend dry fasting. Where people for spiritual reasons or whatever will go on no water fasting. And if you do that long enough, what happens is the kidneys eventually shut down and you die, as we witnessed by one of our internet advocates of dry fasting recently passing away from shutting his kidneys down. So you need to have a solute so the toxins that are mobilized can actually get out of the body. That's why we recommend using water appropriately during fasting.
Which brings to the next question.
What kind of water do you drink?
Yeah, so you want pure water. Water is H2O. And if you took rainwater that in an environment that wasn't polluted, it would just be distilled water. And that's what we use, we use distilled water. So it's pre-filtered, run through fractional steam distillation, and then a post-filter. Because the people fasting are really sensitive. They will not tolerate municipal water with its hydrogenated halocarbons and chlorine and all that stuff. They don't like it. They don't want it. You don't need to spend $6,000 to buy fancy machines to twist your water around in order to, from our viewpoint. You can use any effective filtration system. So reverse osmosis with good filters. You can use distillation, which we use, which we think certainly the best accepted. But any high quality filtration system should work to get rid of the stuff you don't want, which are the heavy metals and the contaminants. People say, well, but wouldn't that suck all the minerals out of your body, as if there was a two-way gradient in the intestinal tract? It's not actually how it works. There's more minerals in one apple than the water you're going to be drinking this week. So you're not drinking water primarily for its mineral concentration. You're drinking it as a solute to give the body, one of the most important things it needs, which is water. So we've used fractionally steam distilled water for 39 years with 21,000 people. We have good experience being able to do that successfully for up to 40 days at a time.
And so if they're only on water, is it important to maintain vitamins, minerals? Do they take their vitamin supplements during that time?
Absolutely not. It's strongly contraindicated. Just like we don't give other toxicity issues like drugs, we don't use supplementation during fasting. Now, you do get your nutrients because you're recycling those. In the fasting state, there's a very efficient recycling mechanism that goes on. That's why somebody might live longer on a water-only fast than they would, say, on a white bread diet. Because you'll develop vitamin deficiencies quicker on refined carbohydrates than you would on water only.
So if someone is doing intermittent fasting, like you said, like just, the regular 12 to 16 hours a day kind of thing, should they wait to take their vitamins for when they start eating again, or can they take those vitamins earlier in the morning too?
Yeah, normally you take that with food. You'll get better absorption, less chance of irritating your stomach. I might mention, though, in my opinion, a lot of people are actually being damaged by too high a concentration of supplementation. They're doing drug-like therapy with exogenous nutrients, and in many cases that can be harmful. For example, vitamin A. They've done a lot of studies where they would supplement vitamin A to see if it would enhance cancer treatment. It turns out people would die at a higher rate inevitably on supplements, so they had to discontinue those studies. Vitamin C in high dosages, especially in pregnant women, can cause vitamin C oxidase to kick in, and you get rebound scurvy in babies born of women that are on high dosing C. Vitamin iron in males, strongly contraindicated, increased their risk for heart disease and other problems. So we want to be careful about all these concentrated pills and potions for people they're trying to take to make up for the fact they're not eating properly. The best way to get your nutrients is to eat a whole plant food SOS-free diet. Now, it's true, there are some nutrients like vitamin B12, which come only from bacteria, that if you're on a strict vegan diet, you're going to want to supplement 1,000 micrograms of methylcobalamin a day, or cyanocobalamin, whatever form you want to take, because you're not going to get the bacterial contamination that people getting all that nice fecal contamination from their meat is. So, rather than eat source of bacterial contamination or not washing or peeling, and then you get worms and parasites and other problems. So in a modern world, B12 supplementation makes sense. It's also water soluble, not likely to cause problems, unlike some of the fat soluble nutrients, which you got to be careful about quantitative issues.
But if people have have regular levels, they should be able to just coast on that through a 10, 20, 30-day fast.
Oh, it'll
on the
take
B12.
months or years
Right.
to deplete. You don't need, there's no worry about in a 40-day fast worrying about supplementation. That's not, but I'm just saying overall, there may be
Okay.
times where supplementation might have a role for an individual, but you can also do damage there. Because remember, most people that are sick from dietary excess, not from deficiency. And so treating everything as if it's a deficiency by giving high doses of supplements may help the doctors prescribing the supplements or the stores selling the supplements, but it's not necessarily helping you as the person taking them. You don't want to be taking things that are not going to be health promoting for you.
Before you tell us about True North and what actually happens there and how people can get in touch and do all that, we talked about intermittent fasting quite a bit, and a lot of people the question is going to be, is it safe for me to do this forever? Is it okay for me to just be intermittent fasting every single day? Or is this something that I need to do once in a while?
Well, intermittent fasting, that is 16 hours every day, is what we've done every day for 40 years at the True North Health Center. And there are people that wouldn't be appropriate. For example, if you're underweight and trying to gain weight, 8 hours may not be enough feeding window on this food, which is very low in caloric density and very high in nutrient density. You might have to eat more than you can eat in 8 hours. So for people losing weight, that's an advantage because they're not going to overeat. But let's say you're treating kids or you're treating people that you're trying to put weight on. They might need a 12-hour window. So they would still get 12 hours of fasting every day, but it may not be appropriate for them to try to go to 16 because they just wouldn't get enough calories in. So it's not that you don't have to tweak this a little bit depending on what your goals are, but everybody fasts every day and they break their fast with breakfast. The only question is what's the optimum duration of that fasting
we
period.
get people ask us very often, what do you think of intermittent fasting? I'm like, everybody should be doing it every night. We shouldn't be on the couch eating
you
the
don't have to
popcorn
wake up at
11
3 o'clock.
at night.
Exactly. You shouldn't be eating the popcorn at all at 1,800 calories a pound. People thinking that popcorn, that's without the coagulated cow putts all over it and stuff. So it's not exactly what you call a health food.
Right.
So is there anybody who should not go to True North Health?
Yeah, anybody that is not really motivated to get healthy. If all you're looking is for some short term, I want to lose a few pounds to get in the dress for the thing, and then I'm going to go binge out. You're not going to be happy here. This is one of the more difficult things people do, adopting a whole plant food SOS-free diet. Fasting itself isn't that hard, but you're not going to be happy if you're looking for the quick fix and the fast way out. The people that we get are really properly motivated. The best motivation I found is pain, debility, and fear of death. That really gets people motivated. They're willing to do anything, even eat well and exercise and go to bed on time, and all these really radical things that we talk about. The other people that do benefit, I think, from True North are people that are struggling to make diet and lifestyle changes. They want to make changes, but it's hard because they're an addict. And so this can be a way of helping them break free, just like an alcoholic sometimes benefits going to a facility where they can kind of get cleaned up. This is a chance to break your addiction to salt, oil, and sugar. Some people come in just because they want to go to a place where they can relax for a week, do a little clean out, and not have to put up with all the normal stresses. And they can have a place where they can eat whole plant foods, and they can be around people that don't think they're a whack job just because they're taking a few days off. And so I think,
don't know how people go there and fast. Sorry to interrupt, but I see people's pictures and I hear what people say leaving there. I don't want to go there to fast. I want to go there to eat.
Well, I actually have some businessmen or patients of ours will come in and they'll stay at the center when they're in town, even if it's for a day or two, just because, well, first of all, it's cheaper than the DoubleTree, and they get all their meals, and they like to take advantage. So if we have holes and stuff, they'll fill those holes just to, like you say, not to fast. I have to say, though, 80% of our patients right now are coming for medically supervised water-only fasting. 20% are coming, they may not be a candidate for fasting, but they're coming to get the diet and the lifestyle, or just to see a doctor that's not an idiot. I mean, that's one really nice thing is we have medical doctors, chiropractors, osteopaths, psychologists that are all oriented towards whole plant food, SOS-free living, exercise, sleep, and understand fasting and its role. And that's a really valuable tool because most doctors, if they've never seen anybody get well, they have no way to help you actually get well. we have an internship and residency program. If any of your viewers are physicians that want to do something worthwhile with their life, they can come at no cost. We'll provide them room, board, training, so they can learn how to use a diet and fasting to get their patients well. And the most common comment from the residents is, wow, I've never seen anybody get well before with these conditions. Because, you know, they may have treated their patients their whole life without actually seeing them recover, because they're giving them pills and potions and powders rather than serious advice about actually dealing with the cause of their problem, which is often diet, sleep, or exercise deficiency.
So for our listeners that want to reach out to the True North Health Center, where do they go? How do they find it?
TrueNorthHealth.com, TrueNorthHealth.com, everything they need. And as I mentioned, we have a free service. If they want to talk to me, I'll have a conversation with them on the phone. Just fill out the registration forms on the website and be happy to point them in the right direction as best I can.
Well, thank you so much for your time and your expertise. We're so excited to have you on. It's wonderful. Hopefully we'll get our parents to stay with the kids one day, and we could come down for a
Absolutely.
nice little
Well, you should come and do
supervised
a
eating
fast
fast.
and do a show from
Okay, we'll
with your
fast.
fasting experience, and you can tell them how intense it really is.
Yeah, that'll be fun.
Sounds great. Well, thank you so much. We
Brilliant.
appreciate your time.
Thank
My
you.
pleasure. Anytime.